Hello, I'm Ify Okocha, Deputy Chief Executive at Oxleas, and welcome to this week's live edition of Oxwide. Later on in the program, we'll see how the new communication access symbol is changing the lives of people with a communication difficulty, and catch up with Sarah Hayward about how we'll be taking this forward at Oxleas. Also coming up, Neil Springham and Marcianne Coggins talk about patient advice and liaison service and the complaints process with Lisa Tan. Before all of that, we've once again got an update for you around COVID and how we'll be rolling out regular testing for colleagues starting next week. Our most recent figures show that currently around 60 members of staff are off due to COVID. However, overall staff sickness is no greater than we would normally expect at this time of the year, and far less than we experienced in April at the height of the first wave of this pandemic. Our services are therefore coping. However, currently, clinical activity is high, with a number of young people attending emergency departments, very ill people in our inpatient beds, and quite busy community services. However, we aim to maintain our service during this second wave, and so far we seem to be doing that really well. We have around 20 inpatients with COVID, and a further 20 are awaiting their test results. In our prison services, there are over 100 cases, and we fear that that number may rise. We are not experiencing the same level of infection as we had at the height of the first wave, and that is reassuring. However, this does not mean that we can let our guard down, and we must take all necessary precautions and maintain social distancing where possible to reduce the chance of infection. To reduce the risk of infection further, we'll be rolling out a regular testing program for all patient-facing staff from next week. I'm really pleased and delighted that McGowan, who is leading on this program, is able to join us at this time. Hello, Ellen.
Hello, Ify.
Can I start by asking you, what does the testing program involve?
So these tests are known as lateral flow tests. Basically, it means that staff members can test themselves for the COVID-19 virus without a sample having to go to a laboratory. They involve a nasal swab and a little cartridge that looks kind of like a bit of a pregnancy test and works in a similar way. The staff member can undertake the test at home, and they should get a provisional result within 30 minutes of them taking the test. We're giving eligible members of staff each box contains about 25 tests, which should be enough for about 12 weeks because we're asking them to test themselves twice a week. And then once they've taken the test every time, we're asking them to then share our results with us.
So can you just go over which members of staff will be receiving the test kits so everyone is absolutely clear on that point?
Okay, so in the first instance, and this may change, we've been given kits for patient-facing staff. Now, this obviously involves Oxleas clinicians and admin in patient-facing areas, but also includes some of our contractors, regular bank staff, agency staff. What we're trying to do is roll out to anyone who's got regular face-to-face contact with service users.
Thank you. And what do they need to do? Swab? Test themselves at home twice a week?
Yes, it will be twice a week, we're asking. The reason being is that this test is slightly less accurate than the laboratories. So what we want to do is make sure that we get early detection and that there's a continuous process to make sure that we're controlling the virus and the spread of the virus over the next few weeks.
Okay. And two more things I want to check, if I may. One is, how will they share the results, and what do they do if the test result is positive?
So what we're doing is setting up a portal, which we will test in doing the final bits of testing at the moment, and we'll go live. It's via an internet link where we will ask staff to register their kit, and then as they take the results over the next 12 weeks, that they upload them and that we collate those results. Where there's a positive test, and we just be mindful that this is a provisional positive test because the testing kit is less accurate, we will be asking staff to first of all contact their line managers to let people know. Second of all, to isolate. And thirdly, to get a confirmation test, and that's either via the Queen Mary's site, which we've set up to support staff, or via the government system, whereby they can order a home kit or go to their local area.
That's very clear. Thank you, Ellen. And just one final question. And how can colleagues find out more information?
Okay, so we're working with directorates around the distribution, and at the time that they receive their kits, they will also receive some information and some guidance about how to take the test. In addition to that, we're putting some designated resources on the Ox, a how-to video, for example. We're also setting up a helpline, and there's a designated email inbox as well.
Thank you so much, Ellen, for joining us today and sharing details of another way in which we are combating this pandemic. Thank you. There has been a lot of discussions about a COVID vaccine on the horizon. But currently, we're focusing within Oxleas on getting vaccinated against flu. Flu is a real risk. We have a vaccine that is available to us now, so we must take advantage of this to protect ourselves, our families, and our patients. So if you haven't already had your flu vaccine, it is vital that you get yours in the next few days. We have vaccination clinics across the whole trust and have extra drop-in clinics at Memorial and Queen Mary's Hospital this weekend. We have also set up a clinic in Maidstone next week, so if you live in Kent and are working from home or working at prison services in Kent, then do please take advantage of this. Details of all of these are on our staff intranet at the address on the screen now. Now we're going to hear about a new campaign to increase understanding and support for people with communication difficulties. Yesterday, Sally Bryden caught up with Bex's speech and language therapist, Sarah Hayward, to talk about the campaign. But before that, we have a short film by Communication Access UK explaining a little more about the project.
This project will hopefully make this world a better place and a safer place for people who stammer and with different communication needs.
I am fast learning, but I am slow to reply. Please give me time.
People might not see my disability, and sometimes people might not see I have a problem.
I have cerebral palsy, which make my body do different things to my brain ask me to.
Having stammered since I first spoke, it can affect me in different ways, in different circumstances, depending on who I'm talking to, depending on where I am, depending on who's there.
I think communication access is important because communication is our way of interacting with other people, and to be able to understand people and to give people time to understand and to make relationships with people through the communication is vital.
Hopefully having something communication signal could maybe let people to be understanding of the fact that I can take what you're saying, but you kind of need to maybe help me a little bit.
It's good to teach people a really appropriate way of communicating with people with communication needs.
Every one of those who's educated around this area, it will only help any of us who've got issues with communication.
This potential for people who will be trained to actually help you, you think, flip it out, this is more than you could imagine, honestly.
Because I believe everyone is the same.
We're joined here today by Sarah Hayward, who is our research champion for speech and language therapy. And we're going to be talking about the Communication Access project. And we've just seen that really powerful film about communication issues and how we can support people with communication needs. And I just really want to talk to you a bit more, Sarah, about the project and what it's aiming to achieve.
Okay, thank you very much, Sally. So the Communication Access UK project is a joint initiative between the Royal College of Speech and Language Therapists and some business partners and also third sector organisations. And we know that 1 in 5 people will have a communication difficulty across their lifespan. And the project is really just aiming to make businesses and premises accessible for those people. When they see the symbol, they can feel confident that their needs are going to be met and that staff are going to be trained to try and meet their communication needs.
Thanks. And how can we support it here at Oxleas?
Okay, so I'm heading up a team who are hoping to get accreditation for Oxleas. We're going to start with some pilot projects among our non-clinical staff. So this project links in really well with our accessible information standards, and that's something that the CQC require us to do. So what we're looking to do is to train those staff who are patient-facing, who have probably the first contact with some of our clients and our patients, to just feel confident in meeting their communication needs. And once we're accredited as a trust, we'll be able to display the symbol, and then people will have confidence that they can come in and that they'll be able to use our services. So, yeah.
Great. And where would people be able to find out more information about the campaign, and who's actually leading the campaign?
Yeah, so as I say, the Royal College of Speech and Language Therapists are the lead. If you just Google Communication Access symbol, that will take you to the website. You can have a look there. What we want to do is to kind of go into different areas of the trust, introduce this to people, and then we'll be asking people to sign up and to do the online modules to get accreditation. But we'd also like to collect some data so that we can look at the impact on our staff and also on our service users. So if people are interested, they can certainly contact me and we can put them on the list for us to come and train. That would be wonderful.
Oh, that's great. And if before people have been able to take part in the training, are there any tips you can give to people that if they do come across people with communication needs in their everyday life, what's the best approach to take?
Okay, so there's an acronym that goes with the symbol, and the acronym is TALK. So it's quite an easy one to remember. So the first part of that is time, so T for time. So just giving people time and space to not only listen and hear your message, but to also compose their own message to reply. Ask is the A. So ask people what helps, because everyone with a communication need, there'll be different things that help to support them. So just, having the confidence to ask someone, what can I do to help you? And how can I make this easier for you is really valuable. Listen. So obviously that's listening to our clients and our service users, but also listening to any feedback that we get as a service about how things have gone well or how we could improve. And then the final one is to keep trying. So I think that's on an individual level, keep trying to to talk to someone, keep trying to hear their message, and also keep trying as a service to constantly improve and make sure that we're meeting people's needs as well as we can.
That's great. That's really helpful, Sarah. We'll look forward to seeing how the campaign develops across Oxleas. Thank you for joining us.
Thank you, Sally. Thank you.
Thank you to Sarah and Sally there. It will be interesting to see how this develops as we work towards accreditation in Oxleas. Moving on to an issue that hopefully many of you will not have to experience often, and that is around complaints in the organization. Earlier in the week, Lisa Tan spoke to Neil Springham, who incidentally will be taking up his role as Director of Therapies in January of next year, and Marcianne Coggins from our PALS service about how we work together when a complaint is made. Here's what they had to say.
So hello and welcome to Oxwide this week, where we're joined by Neil and Marcy in our complaints department. And we thought it'd be useful to talk about the complaints and how things have been working during the pandemic and what sorts of information has been coming through. So, but if we start with you first, Neil, you've recently taken over from Michael Whitney, who's retired as the Director of Therapies. And can you give us yours? I know complaints is not something that's new to you. But can you give us your sort of thoughts and views and what you've got in mind for the future?
Yeah, absolutely, Lisa. So I'll be starting on the 1st of January, but I am aware of the complaints department because I've worked with patient experience and complaints for a long time. Really grateful to Michael, actually. He's left us in good order. What I really like about the complaints is the way it sits within patient experience and we can think about it there. In a nutshell, my view about complaints is it also sits with the director of therapies because I think it's sort of about the emotional intelligence of the organisation. It's how we respond to not only the factual things of how things may or may not go wrong, but how service users and families feel about it. So to me, I've got a long-standing interest in all of these things, so I'm really looking forward to the role.
Great, thank you very much. And we've spoken fairly recently, Marcy, about the complaints and the process and how that's done and how information is gathered, etc. But I want to talk to you a little bit more about some of the content of the complaints and, you know, what are the sorts of things that you think, that the themes you see coming through? It feels like it might be some of the smaller things that make a bigger difference.
Absolutely, Lisa. I mean, we can guarantee pretty much when we analyse the data that the top 3 issues raised every time will be around communication, clinical care and staff attitude. Clinical care, because that's our job, that's what we do, that's the majority of what we provide as a service. Interactions with staff can be difficult when you're not feeling at your best, so I can understand why we see staff attitude perhaps being raised as an issue. And communication, even though that stands as an issue on its own, when we look at all 3 of them and triangulate that information, we can see communication is a common theme through staff attitudes and in clinical care as well. So it's about speaking to people, being in the moment, explaining what's happening and making sure that people are aware. Again, we find that a lot of the action plans have issues regarding communication and how we're going to help improve it with staff. They tend to come up quite frequently. So it may be things like reminding staff to communicate with relatives, because it has a massive impact on an entire family when somebody's unwell, and that can improve the situation for both the patient and for the family.
Yes, thank you, Marcy. So, Neil, it's a difficult time at the moment for everybody. We're under a lot of pressure, and you know, obviously that doesn't mean that complaints stop coming in; they're still coming through. And how can we advise colleagues to sort of think about the complaints and handle them? Because it must be hard if a complaint comes in with regard to an area that you work in to not take that personally. I imagine I would.
That's a great point, Lisa. I've had complaints made against me. And I've experienced that, and I've also had experience of investigating those things. I think one of the things I think all of us need to be aware of is that the pandemic is ongoing. We're going into winter, we're fatigued, our service users are fatigued, and we have a sense of what will happen. I think it's possible that we may receive more complaints, but if we do, one of the crucial things that I think teams can do is to still keep looking at the complaints and looking for themes. I would really advise people to take complaints seriously, but not take them personally. That actually we are a learning organisation. My interest is absolutely in pulling out themes once we've corrected specific things. Because actually, if we can keep alive to that, then I think we kind of keep alive to our service users, and it stops a bit of a vicious circle of perhaps feeling you don't want to sort of hear those things. So we need to stay open to them, but it's going to be a challenge, and I think we would be very interested to talk to staff about how we can support that process of staying open to the complaints. As I say, take them seriously, but not personally.
Great, thanks very much. And if people do, you know, want some advice or some support and some help during a process of a complaint that might be going on, what do you advise them to do, or where do you advise them to seek help, Marcy?
They can always contact the complaints team. There are normally 3 to 4 of us in the office that are more than happy to explain the process, talk people through if they're feeling stressed about the process. It can be quite distressing and upsetting, even if the complaint isn't about you as an investigating officer, knowing that you're going to have to go and speak to people and perhaps impart information that could be difficult. So again, come and talk to us. We're very experienced in difficult conversations. We can help you with how best to deal with things. We can advise you who's best to help you from a clinical information side and get you support that way. But one of the things we're very keen to help people with is working on action plans to make sure that it's not just about investigating a complaint and responding, but that we're actually learning from it and that our action plans are robust and that they happen, that change happens from a complaint.
Lovely. Well, thanks very much for joining us, Neil and Marcy. And the takeaway for staff, if you're involved in any of the complaints processes, is take it seriously but not personally.
Thank you to Marcy, Neil and Lisa. And I hope that helped to reassure people that whilst all complaints are taken seriously, we aim to treat everyone fairly and with compassion. Well, that's it for this week's Oxwide broadcast. Don't forget, if you want to get in touch, perhaps to appear in a future episode, or just to give us some feedback about our program, please do email the address on your screen now. We'll be back in a couple of weeks' time, where hopefully we can give you a positive update about the rollout of our staff testing. And in the meantime, please do keep checking the Ox and your emails for the latest news. But until then, thank you for your time today, and we'll see you again soon. Goodbye.